Hi everyone, it's Dr. Garza at Girls to Women, Young Men's Health and Wellness in McKinney. Today I just want to check in with you all and talk to you about how therapy is used in our office. I've said before in our practice we offer a comprehensive approach, and that is one where we address all of our patients' medical and mental health concerns. So, as mental health concerns come up with visits with me or through patients calling our office, I often will refer patients for counseling and therapy. I advocate for therapy with my patients because I see it as such a useful tool to my patients in helping them better understand themselves, to kind of learn about what they value, in also working on their internal value and self-esteem. Patients will also work on communication skills, relationship skills, and I talk about a lot with patients how to build healthy coping skills. We know as adults that stress and challenges can just be a part of life, and it's how you cope with them that really makes a difference. I often will see patients that are not coping in a healthy way. They may be turning to substances to help cope. They may be dealing with eating issues or disordered eating. There's also even just behavioral things as far as isolating or withdrawing, procrastinating, quitting things. Those can all be ways of coping with how they're feeling emotionally, and we think of that as unhealthy. So, in therapy, my goal for my patients is for them to learn how to cope in a healthy way and how to manage the stress that they have in their life in a healthy way. We have two therapists as part of our office in the McKinney location, and those therapists are open for direct appointments, meaning that patients do not have to be seen by me in order to see the therapist. They can access therapy directly through getting their information on our website or by calling our front desk, and our front desk staff will provide their contact information. The main form of therapy that is used with adolescents is what's called cognitive behavioral therapy, or CBT. Now, I'm a novice at this. I was not trained in it in medical school or in my profession, but what I've learned about CBT is that it looks at how your thoughts and ways of thinking affect how you feel, and then how that affects how you act and behave. And so by understanding those connections, patients can make shifts to certain thought patterns that can help them feel better, and then maybe act in ways that they feel better about in the world and in relationships. So that is the main approach. There's also other therapy approaches that are dialectical behavioral therapy, and there is just other tools that therapists will use in helping patients work through their concerns. Now, both of our therapists see patients, one down to age 8 and one starting at age 9, and they see patients through the early teen years, late teen years, college, and young adult years. And so they're available for consultation. And Holly, who's one of our therapists, her interest is in trauma, in eating disorders, in substance use disorders and addiction, also interested in personality disorders, and then she also addresses more general concerns of anxiety, depression, and those types of mental health issues. Our other therapist is Natalie Hudson. She joined our office in June. I've done a little bit of promotion of her practice within our practice recently, and her areas of interest are eating disorders and body confidence, self-esteem, body image issues, as well as general mental health, anxiety, depression. And so they both are very compassionate and easy to talk to type of people that can help with how my patients are feeling. And then, we work together in collaboration. So they may be seeing patients frequently for therapy as I'm managing their other medical concerns or managing their mental health medications. So that is part of our practice that is unique. And I feel like therapy is something that can be useful to all patients. It does not have to be in response to a crisis or a trauma or something that's not going well. It can be a self discovery process as patients feel that they learn more about themselves, they grow and mature, and it can be a proactive process in that sense. And so, there is a role for therapy in many patients that I see. So you can check out more information on our website. They have their photos and bios there. I shared a little bit about this on Facebook. And if you find that you have someone in your family or your child is someone who could benefit from starting a therapeutic relationship with a licensed therapist, then please give our office a call to schedule with either Holly or Natalie. Have a great rest of your day.